I mean, for me, the main problem that I think it's happening in a lot of countries, but especially here in Catalonia and Spain, it was like the control of the information, the kind of censorship that governments, central government and autonomic government have they try to control the story, the information that comes out, So it was really difficult. Now it's a little more easy, but at the beginning to get access to hospitals, to ICUs, the medical staff was getting a lot of pressure from the directors of hospitals, from the governments, local and autonomic government and the Spanish government, so there was a lot of fear for doctors and nurses to speak out about the situation of the PPEs, the conditions of work. So that was for me that was the biggest challenge, to see how badly managed, how bad was the response of the government, and at the same time there was a lot of fear for people to speak out, and how the governments were trying to control the narrative of this story, Also very frustrating to see how the majority of the media were just following up the official version. We saw it when at the beginning of this happened, at least in Spain, the majority of the media was praising how the government was reacting. There was also a call for, let's not panic, it's just a flu. We should be all relaxed, And then I think you don't need to be like Einstein or expert in science that, okay, I understand that you think that it's far when things are happening in Asia. But when you have like daily planes from Asia to Europe or to your own country, you have to start to worry. And then when things are happening in Italy, for sure it's going to come here, and it's so strange. Like it's still difficult to understand how governments, authorities, they didn't react way before, I guess they worried more about the economy instead of the health of the people, or maybe they're just incapable to react or to think, or they're worried about other things, their careers or political electoral fights, and or their seats, to don't lose their seats. But yeah, the main frustration was to get access to hospitals, to make people to speak out. I think we saw this in Italy, but then as the situation was getting worse, the Italian doctors also started to speak out more and to give access. So here, I think it happened a little the same. Like first, people was afraid, there was a lot of pressure from authorities and this, but then little by little, people start to speak out.